Hi everybody, Dr. Sunil Dand, internal medicine doctor, finished a busy workday today. We have to be doing a better job of protecting our elderly from COVID-19. Now, since the beginning of this pandemic, our whole response has been characterized by knee-jerk reactions, leaders feeling like they have to respond to the data, and we've been really neglecting the vulnerable populations that we should be protecting the most. Now, I live in Massachusetts, and that's a classic example. But this has happened all over the country with other states and even all over the world as well. Leaders see data come out and they just have to respond, even if those responses don't make any sense and don't really help. Classic example, last week here, we had Governor Baker come out and make some new announcements about limiting gatherings, saying that we all had to wear masks for a little bit longer when we were seated at a table in restaurants before we eat. Before that, we had restaurants closing a little bit earlier. And let's think about this. What leaders should be doing is taking a step back and thinking logically and with common sense. Will closing a restaurant an hour or two earlier really help slow the spread of COVID-19? If you have two fewer people sitting at a table, is that really going to make a difference? One can certainly make the argument for, okay, if people go into lockdown, if you lock people up completely, of course you will slow the spread of COVID-19. But I'm not an advocate for that. That comes with enormous other consequences if you go into a complete lockdown. When it comes to community spread, all right, there are ways that you can do that, but we have to have a more targeted response. We know from the data, and I certainly know from the front lines, what types of people are getting seriously affected with COVID-19 and being hospitalized. If this is really about slowing down hospitalizations and saving lives, we have to be focusing on those groups. And that is overwhelmingly the elderly and those with chronic disease. Classic example here with Massachusetts, the latest restrictions. They had a whole list of areas they wanted to target, including trampoline parks, laser tag venues. I mean, who plays laser tag anymore? But if you look at the list that they came out with and what they were talking about, there wasn't even one mention of targeting and protecting the vulnerable, which are mainly the elderly. And I don't care if I have to say it till I'm blue in the face. Protect, protect, protect the elderly. That's what we should be doing. If I was in charge, every single regional and national meeting would start and finish with a message on protecting the elderly and vulnerable. This is what we should have been doing from the very beginning. So while, yes, you can certainly make an argument for slowing spread within the community, we have to be doing a better job. We can't be going with these knee-jerk reactions and leaders feeling like they just have to do something, make some kind of announcement. There has to be some logic and common sense here in targeting and protecting the vulnerable groups. We have done a terrible job with this since the very beginning.